Okay, good morning. Good morning, everyone. Thank you so much for joining us on this Friday. Very delighted to, thank you. I'm very delighted to present Vitalli Klymchuk, who's a postdoctoral researcher at the University of Luxembourg. And prior to that, he completed a postgraduate diploma in global mental health from our school in 2023. And since then, he's been working in various policy, capacity building, research, and knowledge exchange projects throughout Europe. And most recently, Vitalli was awarded the Alumnus of the Year at the University of Glasgow. And I'm really delighted and pleased to join us today for this talk in person. We have a hard stop at 11, and the plan is for Vitalli to present about his personal and professional journey for about 30-40 minutes, and then we can open the floor for Q&A. So I'm very delighted to give the floor to Vitalli.
Thank you, Jim, for the introduction, and thank you all for joining and to see me and to listen to me. I hope I will not disappoint you and will spend this time useful. Let's talk about the most interesting thing about me. So I'm Vitalli Klymchuk, and I will do today's talk. I will switch between professional and personal things because in my life they are absolutely intertwined, connected, and sometimes it's just impossible to untangle them because actually I met my wife at work 20 years ago. And since those time, we are living and working together, doing joint project, definitely developing it in different fields, but nonetheless working together. And now my son is participating in a research competition, and he will present his study next week in impact of shopping on mental health. Yeah. I think he will not go into mental health because he wants to do business. He's more interested in shopping than mental health, and more in those side of shopping which can relate it of earning money by selling people different goods. So now he's looking for different business schools all around the world to continue his study, to make this. He already has two businesses. He is writing music and selling his music in different kinds of this account. And he is also buying different goods and selling these goods in school. Earning his some not a, for him quite substantial income. So just everything is so interconnected. So about me. I sometimes just get stuck in the question of what are you doing and what is your profession and what is your area of work. So my area of work is service. I'm a psychologist by background, but not a full not complete psychologist because my higher education is in physics and maths, and I'm teacher in maths and physics. And, but also after this, I did a lot of additional education, and I did my PhD in psychology, and I did my training in psychotherapy, and I had my practice, and I worked now as a researcher, and worked a lot as a researcher again for more than 25 years. I'm still thinking about myself like just recent graduate from the university, just like, wow, 25 years. A writer, I will show you some. And mental health and policy expert, I will also delve a bit into this topic, and a project manager, the area of mental health. So that's my identities, which sometimes some of them are a bit kind of on the background, like my psychotherapeutic identity. I didn't do psychotherapy already 5 or 6 years. And my writing background now focusing mostly on articles and not on writing books. And I guess researcher, mental health policy expert, and project manager, that's my 3 main identities for now. What I'm doing currently. Again, the same thing with my identities. I never did just only one job or only one position. I usually have 2, 3 positions in different projects, in different institutions and different organizations. It started as soon as I graduated university. I started to teach students, and I started to do my PhD. And at some point, we understood, okay, I can do more. I started to do more teaching in different other universities, and also started to run different projects. And I understood that I can keep up with everything, with all this project. Sometimes it's a bit overwhelming, but nonetheless. And my main part of job is working in the University of Luxembourg, and we are working on the project. We are implementing EU-wide capacity building program in promoting multidisciplinary approach to mental health. So we have two, I would say, 2 main activities. One activity is exchange program. So we have 6 countries. They act as our hubs. It's Croatia, Spain, Austria, Czech Republic, Netherlands, and Finland. And people from all over Europe apply and travel to those countries and spend 2 weeks exploring services, mental health services, exploring a different type of support which provided to people with mental health conditions, engaged in observations and engaged in different kind of things. And the key feature of this exchange program that we accept not just mental health professionals, we accept 4 types of we accept people from 4 types of services. Obviously from health sector, but also social sector, education, and justice. And so group of these multidisciplinary groups from different countries coming together one place. For example, right now there is group in Austria, and there is now group in Spain. I will travel to them next week. And another part of this program is developing of multidisciplinary training program. So we are developing training program. We will start piloting this program May. And we are going again. We start from 6 countries, and then we will spread all over the Europe. This idea to conduct this training program in each European country. Idea is again to collect different professionals at one place in one room, and engage them in this multidisciplinary casework and promoting this idea that they can work together. We as social workers, mental health, psychologists, psychiatrists, teachers from schools, they can work together, supporting people's mental health. Not just by doing something at their workplace, but actually communicating with each other and actually supporting each other. Let's see how it goes. And another part of my job is working with UNICEF. It started small, but now I have 3 consultancies with UNICEF. One part we are implementing, I'm supporting implementation of mental health module in a MIX survey. MIX, it's a multi-cluster survey, household survey, which UNICEF conducts support in different countries. And just last year, they developed mental health module for this survey. So now I worked last year with Kazakhstan. Now I'm starting to work with Albania with implementing this mental health module. So we are doing this culture adaptation, and we are doing tailoring, and we are doing the training for field workers in this module, and that they collect data, and we support this process of data collection. Yeah, maybe soon also some other Eastern European countries will join this implementation. Also, I'm working with, last week I started work with Kazakhstan again in supporting developing the mental health action plan, new iteration of the mental health action plan. And also, as a MHPSS trainer, I'm delivering different global MHPSS training for Eastern Europe and Central Asia. And in Ukraine, also, I'm still working. That's my kind of project, which I was, I would say, it's a project which, within this project, I did most of my work related to development of mental health system in Ukraine. This project was started 5 years ago, and we have still four years to go. As kind of long-term project supported by Swiss government. And I'm still working, not a full-time definitely, but still working this project, and also working with OSCE. And in this project, we are working with State Emergency Service. Next month, I will start training of psychologists in delivering this trauma-informed approach and in trauma-informed support to staff of State Emergency Services, and also my small involvement of my volunteering work with our choices in work group on disability and inclusion. We are collecting best practices in inclusion of people with disabilities with health services, and best practices in supporting access of people with disabilities to healthcare services. So if you have good practices, just reach out to me. I can promote them in this work group, and it will be included in final report next year. So that's kind of what I'm doing. Now a bit of history, how it was started. It was started not with Chernobyl explosion. I was born earlier, but I was 7 years, I guess 7 years old when we had this nuclear explosion on Chernobyl station. Well, I'm showing this picture because probably that was one of the points when we understood Ukraine. Oh. Okay. It should work right now. It's loading, yes. It's one of those points in which most of Ukrainians understood that being part of the Soviet Union, it's being part of big lie. It's a big being part of big part of propaganda machine. Because you know the story when maybe you saw it on Netflix, and there is like not very nice series on Netflix, quite close to the truth. That after this explosion, they kept this truth about the explosion away from people and away from media and away from everything. And people just went to the manifestations. They were just exposed to this danger. Why I'm showing this? Because just recently we spoke with my wife that we went through quite a lot of different social disturbances in our country. We went through the Chernobyl explosion, but then we went through the times when Ukraine became independent, and Soviet Union was kind of dissolved. And it comes with a huge economic crisis. And not just economic crisis, but it also came with a huge crisis, moral crisis. For example, my parents, they overnight, they lost all their savings. They were multiplied by zero. And this state, when you wake up, when you go to sleep, and before it, you bought a bread for example, 10 hryvnia, and you can wake up, and the bread will cost 100 hryvnia. And next week it costs 1,000. And so I grew I in this picture. That's kind of very typical picture from those time when we had this street gangs and organized crimes, and those people who kind of ruled, not just on the top level, but also on the bottom level. It was very unsafe to go through the streets. And I remember my school, and I guess 30% of my classmates into jail after they reached certain age. Times were very unpleasant. Why am I bringing this up? Because just I'm trying to always understand what's happened, why I was not there, why I was on the other side of the street. And I guess that was because of the books. At the same time as the things were happening, our market became open to the world, and they started to translate books, translate fantasy, translate science fiction, translate non-fiction, translate all these brilliant books which were written, and they became suddenly accessible to us. That's something that changed my life completely. The possibility to read and has the possibility to dive in those fiction world away from this world. And second. And that's my university. When I was in this building, exactly in these buildings, I was studying physics, math, and had idea of becoming teacher. Also, I didn't have this idea. It was my parents' idea. And I was more or less okay with it because, going to Kiev, and it was too expensive. You remember the previous picture? And it said, okay, that's kind of the easiest way. Just go with the flow, the easy way, go to the teacher. Teachers will be always needed. And you kind of be respectful and with pleasure. It went not as planned because I didn't become a teacher. I became, as a final, I am a teacher, but not in the physics and not in the math. I became a teacher and became a professor in psychology. It's me. Yeah, I was okay. And that's and here is a person which is he is responsible for me becoming a psychologist. He is responsible for me actually staying here now with you, because that was he who I was in the third grade in my university, so for the third year, and we had this courses on development psychology, just usual for teachers to go through development psychology, education psychology, etc. And he told me, okay, what can you think about doing research in psychology? And I was kind of, I don't know, let's try. Next year, I came to him and told him, okay, let's try. Let's give it a try. He gave me a huge book very scientific book about psychology, and told people, okay, you read this book and you come to me, ask me questions. Then we will see how it goes. So since those time, I won 2 research competitions at university in psychology and at the national level, and then a few others kind of this national competitions in psychology for students, and obviously started doing my PhD in psychology, etc. That's actually that's a place. You don't see there are a lot of computers over there. This lab, it was my first workplace also. I was working with IT and those laboratory. And here's another revolution. That's my first revolution. We had a revolution in Ukraine before, but it went past me. That's 2004. That revolution. That's we call this orange revolution. Orange because of this orange colors. It was kind of colors of one of the political party and President Viktor Yushchenko, his campaign. Actually, that was the first time when I was born as a citizen. That's the time when I was born as a person who is trying to understand what is wrong, what is right, what is the corruption, what is the opposition of corruption, what is the truth, and what is a lie. And it was the first time when we, as professors at university, faced this attempt to push us into some political decisions. Like you should vote for Yanukovych, our former president. You should kind of vote in this and this and this way. It was also the first time when I tried to push back, and we kind of said, no, it's not right. We will vote for whom we want, and we will not push our students to vote for somebody which you think we should push them. We will not push it. We will allow them go to the protest. We will not kind of punish them for missing those lectures, because it is important. It is more important than studying. Yep. So that was my first experience. We won this revolution. Yushchenko became president. It was first president in Ukraine which brought a lot of important topics, and which this president which supported this our movement towards European Union, towards European values. And after everything gets settled, it's another picture from my life. I told you I was trained in psychotherapy. So my training, I was trained in cognitive behavioral therapy, but also I was trained in psychodrama. That's grave of Jacob Lévy-Moreno. I think you know him. It's a founder of psychodrama approach. Again, that's to be trained in psychodrama, you have to go through all your own psychotherapy. You have to go through your own client's experience. For 2 years, I was part of psychodrama group. I was going and exploring myself and growing. And also, I'm showing because especially we went to Austria, we went to Vienna to make a picture of his grave. Because again, it was experience which also changed me. Experience that made it's crazy with times in language. Experience that made me open to the world, open to other people. Experience that helped me to understand that it's so important not to come to and not to communicate with people with your own prejudice, with your own kind of lenses, but try to step in his role.
Vitalli, shall we translate what the bottom quote says? So the man who needed joy and laughter in psychiatry.
Yep. Yeah, because a psychodrama is very funny. A psychotherapy, it's very lively. It's very active. You know this. You know psychodrama. The idea of psychodrama is to bring out your inner drama into outer world, and having group help and having group around, having people assigning them role. Psychodrama therapists help to kind of to play out your internal drama in those outside world. It's very fun, but also very enlightening. That's another experience. We started to build our own house. We started to build our house. That's I'm on the roof trying to repair a roof, which my workers they kind of did a bad job, and I had to go there and try to do something. We built this house by ourselves. That's just some pictures of it. We laid the fundament. No workers, just me and just my wife. Definitely for this, we hired people because we just didn't know how to do it. But after that, all internal work and all of this kind of things around this, that was my job. That was my job. Again, that was a kind of experience. You know, as I say, to grow, you have to step out of your comfort zone. So that's experience that made me step out of comfort zone. So to go to the to speak with different people, to explore their experience, to understand how to grow these green things and how to make this ground kind of plain and how to a lot of stuff around, and how to have a conflict with my wife and go through them, and how to get different financial troubles because of underestimation of the building costs, and try to get out of them and try to kind of navigate these issues. Yeah, so we sold this house last year. It now belongs to the family with a child with autism spectrum disorder, and I guess it will be a very nice place to live. And we also have across the street another house, and there also this family with son with spectrum disorder. That's interesting. Yeah, it was nice time. And in those time, I discovered also very interesting. I discovered playback theater. Playback theater, that's me. A playback theater, it's an improvisation theater in which actors listen to the story from the auditorium and then play it back. They play the story without preparation, just playing the story. We did this theater with that's my wife, and that's my students. So we did this playback theater with the students, and that was another experience for me again to cross the boundaries. To cross the boundaries, you know, this in power boundaries, you know, like, oh, I'm a professor, your students. No, we did very close. A lot of nice things together. And we're still connected with those students. They are now colleagues. They are our colleagues right now. Yeah, but again, this experience helped me to understand that despite our differences in age and in roles, we are quite the same. We're quite the same people. And then we had our second revolution last 2014. which we call the revolution of dignity. Uh, I would say if during the first revolution in 2004, we learned how to stand for, for the truth. In 2014, we learned how to fight, how to stand for our values, and what does it mean to have a dignity, and what does it mean to give up, to not give up. That's one of the days. The fight between people and between our corrupt government. But we managed. It ended up with a bigger trouble, the war with Russia, 2000. Again, the same year, 2015, 14, annexion of Crimea and annexation of the part of the east of Ukraine. But nonetheless, it was experience which also changed not just me, it changed a lot of people around me. A lot of people around me in terms of how we started to think about our country and how we started to feel our country. Because at those time of, when we tried to get to the Kiev, it was impossible to get to the Kiev because it was there was all this this militia and all this guys, unidentified guys with weapons all around. So we tried to sneak into Kiev in the car which belongs to the funeral service. So we got to this car, we packed different people needed, it was cold, people needed different warm things like socks and other. So we packed this car with things and hide in the car and we just to Kiev. To bring people this different aid and support and etc. After everything was settled, this revolution of dignity, we went to work in Ukrainian Catholic University in the Western Ukraine. That's me again. It's again playback theater. And try to promote this idea of playback theater in Lviv. And here I started to understand what is it to be project manager. What is it to be responsible, not just for yourself, for your family and for your career, but also to be responsible for 10, 15 people around you. I became executive director of the Institute of Mental Health of this university and professor of clinical psychology on the CHEF. And we started to build our master programs. We started to also to engage in grant writing and chip development and mental health promotion, prevention. At this point, I started to understand that, well, I think I have to know something more. I have to learn. And I have to learn. At this point, in those time, I didn't know about University of Glasgow yet. I didn't know about this global mental health program, but I started to understand that I have to go into this, to explore this field of public mental health, global mental health, and how to do mental health promotion. And this is our former Minister of Health, Oriana Supron, which he changed completely. She changed completely our healthcare system. We established NHS. We distributed responsibilities between Ministry of Health and between National Health Services and between local authorities and communities and healthcare services. We created actually from the scratch family medicine in Ukraine. It just in a few years. It's happened just in a few years. And actually, that's she who invited me to be a part of her team in promoting and working in the mental health area in attempts to dissolve our institutions and in attempt to bring mental health at the community level. That's under your kind of guidance. We developed our mental health strategy. That's one of the work meeting. We see people around, I'm fooling around and stuff around. That's we are now working. That's how we work on our mental health strategy. We established, we developed, we created in 2017, December 2017, almost just few weeks before, just few days before New Year. Our mental health strategy, our first ever national document on mental health was approved by Cabinet of Ministers, and it was a huge achievement because again, first ever, we had definition of mental health. It was not yet a law, it's just a strategy. It approved not a parliament, but by just a cabinet of ministers, but nonetheless, the document was there. Definition of mental health was there. Direction of our movement forward was there toward community-based, toward decentralization, toward deinstitutionalization, and toward integration of mental health in all possible services. It all was there. And we started to work on mental health action plan. We started to work on mental health plan. That one was our national strategy, national consultation. We did a lot of national consultation of development of mental health action plan. It didn't well as planned because we had election. And after the election, we elected not Poroshenko, but another president, Zelensky. And if one president goes, another comes. Cabinet of Ministers, also Parliament, also our Parliament was re-elected, and we had new Minister of Health, and then COVID, and we had new Minister of Health, new Minister of Health, new Minister of Health. During 1 year, we had 4 Ministers of Health, different Ministers of Health. It was impossible just to do something. We just started to do collection. We started to say, oh, okay, let's speak about mental. Yeah, come to me tomorrow. We'll speak about mental health. Bumps. He is not at the place. He's not in the office. Another minister. Okay, start again. It was very funny to see how our WHO country office was kind of trying to also to court these ministers, and they took one minister. Brought them to some country to explore something, blah 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 blah. In a few months they bring another minister to another study tour around the world. So at this point we went to the ground, and I went to study. It was very nice time to study. The COVID time. It's just perfect time for study. Everything became accessible online. I found this program in University of Glasgow and accessible online, no need to travel, perfect. And it just was a great time because I started to learn a lot of new things. I received a lot of feedback on my assignment, on my essay. That's one. I'm still doing it. I'm still doing a lot of huge introductions. Like, oh, 40 minutes, I'm still doing introduction. And no time for the main question. I'm still doing it, but
I did not write that.
That's not you. No, that's not you. That's not you. That's from another course. I do not say which. And in parallel, we started to work on the ground. On the ground, I mean, I became, in the mental health Ukraine project, I became coordinator for the east of Ukraine. And we started to build mental health services with support of Swiss government to build mental health services in the east of Ukraine. This one was our study with this to the Donetsk region, to Lugansk region, the Donetsk region, trying to explore and connect with local stakeholders and do a lot of different things like round tables and exploring that's Mariupol, exploring how to build better mental health services and how to with all of these kind of different things.
Vitalli, it's 5 more minutes. Okay.
Yeah.
Two questions. Yeah.
That's part of our mental health promotion campaign in Mariupol city. It's a mural, this 9-story building. And if you want, you can go through this article. It's open access. We wrote this article recently, kind of summarizing our experience with Mariupol, because Mariupol is destroyed, was destroyed, and again annexed by Russian army. So we try to kind of crystallize our experience. Yep, that's also Ukraine became part of the WHO Special Initiative on Mental Health, and here we developed this kind of strategy of this special initiative for Ukraine. And just photo for you, so you will not think that I'm just doing work. I'm doing a lot of other funny things, and they help me a lot to keep up with myself. And I told you about being a writer, so this book which you wrote is my wife. Unfortunately, in Ukrainian, it will be no use for you. But maybe at some point. So it's half of these books are mine, and half of these books are of my wife. And that's my fantasy book. It's not one of those fantasy. And here is my collection of horror stories. I actually translated them. I translated them into English, and now I'm trying to find this agent to get published in English. We'll see. And that's one of the. I was browsing through my photos and found this photo. And that's actually what our Russian army advanced, and how we tried to kind of understand what's happening there, and should we. We lived here in Zhytomyr, and we flew, not flew, but tried to this part. We spent here 1 month, and then there were some travels, and that's my family, wife, that's my son. We are now here in Luxembourg, making Ukraine visible. So just to summarize, what global mental health? So for those who are students here, who are kind of trying to enter this field, I did some summary. One of my summaries, it was just you have to try to travel a lot and communicate a lot with different people who you like and people who you do not like. And get ready to file different slow motions and huge amount of bureaucracy around, because changing the system, that's mostly 90% is changing the papers. And that's just sometimes just impossible, because one paper into another paper. Get ready to have enemies. Our work is about change, and change is about shifting this balance of power, and people don't like change in balance of power, because they like their power. And also, sometimes I have to get ready to do a lot and achieve very little. And sometimes you do just one small thing and you change everything. In Friday night, 1 year ago, on Friday evening, I received requests from ministry. We have to write service package for mental health at primary healthcare level. So NHS can contract primary healthcare doctor to deliver mental health support. And kind of like, so we have like, how much time do we have? Like, it should be ready on Monday. So just one small thing. It's a piece of paper and 2 pages. And now it is done. Our NHS pays to family doctors for delivery of mental health services. And, yes, I have to get ready to. You have to get ready to intertwine your professional and personal life, and just get ready to change the world, because our work is about changing the world. Just this. So, if you want to connect with me, you're welcome to your email, etc. And I'm done. You have 13 minutes, I guess.
Yeah, thank you so much, Vitalli. It's far for talk, any summary comments would be really needed. I would like to pass on questions from the audience. Anybody online, could please have a look. Anybody in the room? Any questions for Vitalli? I have a lot of questions I'd like to convey to people in the room. Yes, please. Please introduce yourself and ask a question.
Thank you very much. Just student. Thank you. To be translucent and one of the key things from your presentation is that you have a mentor that guided you to making informed decision. You tried to always show us and helped you in it. What do you have such platform coming?
Thank you. Actually, yes. Yeah, actually, yes. It's not so very active right now, but I'm planning to reactivate it. A few years ago, I had an idea to establish some kind of local mental health club, so people can connect and just to discuss and meet and discuss different problems in their country and do some plans, actions, maybe just with some questions. Yes, that's you can connect me. So I will connect you to join to this club, and I do hope that then soon I will reactivate it because it exists now kind of a bit dormant at the dormant level. Just people just communicate there. But yeah, maybe I will reactivate.
Thank you. Any more questions? We have plenty of time for now. Please introduce yourself.
Hi, Vitalli. Thanks very much for your talk. I'm Alistair, a PhD student here at Glasgow. I'm interested to know how, in terms of your strategies, how do you approach the challenge of delivering a mental health system that's sustainable with the demand for mental health services and lack of capacity? I'm sure all healthcare systems, but particularly so, I'm sure in Ukraine at the moment. How do you sort of square that circle in how you think health systems for the future should be working?
Yep, thanks. That's a very great question. So it's not it's when it presented, it looks like very smooth and like step by step, but no, it's it's more this kind of we try to do some policy work and have some achievement, but then we got stuck because of different things. And then, okay, we come back and we'll go dive into the community and trying to build capacity. We conduct training, we promote different evidence-based instruments, etc., kind of build this capacity, collecting evidences and promoting them as much as possible. And then something changed, and then we can move forward with policy, and then again we get stuck. We get stuck, and then we can come back, and we huge asset is actually this. Investments are huge assets. Investment in terms of, first of all, in terms of dollars, in terms of the Swiss government, Swiss Cooperation Office grant, which it is for 8 million euro for 8 years. Apparently not so much, but that's enough to keep a team running and to have a lot of activities and to do some to do a lot of work. We do not provide direct services, we just do this policy and advocacy, a lot of different kind of things. But there are a lot of other donors that also and everything is changed actually after 2014. Everything was changed because of first of all, willingness of policymakers to engage in mental health and available resources in terms of not just money, but also intellectual resources, because a lot of people, a lot of professionals, a lot of international organizations, they came to Ukraine. International Organization of Migration, UNICEF, UNDP, they all activated, and a lot of they brought a lot of experts, a lot of resources in the country, and it was all together it all worked out. Month ago, we had, actually, I didn't tell you, we had a law. A law approved by Parliament and signed by President. We have a new law about mental health. And this law is built upon all this kind of years of achievement. And again, law definitely important, but then we'll have another things to do.
Vitalli, please check if you have any questions online.
I checked, but I do not see.
Perfectly fine. Any more questions in the room? Yeah.
Cheers. Thank you very much for your talk. My name is Matt. I'm also a global health student. I wanted to touch back on the program you mentioned at the very beginning, the capacity building program, the one in the EU. This is the Romans
EU
program.
comments, yes.
So this is involving all of the EU countries, right?
Yep.
Have you faced, just out of curiosity, so I also got from an EU country, and this is the first time I heard it, but actually looked it up like while you were talking, and it seems like a really cool project. Have you faced any pushback from any particular healthcare systems within the EU? Is it already implemented? Is it currently being tested within some countries and then being rolled out as the first thing? And from the second, as a second question to that, in terms of stakeholders, out of curiosity, are young people and youths within health spaces also being considered for this? We actually attended the Ukraine Solidarity Project with the European Youth Forum at the end of 2023, and one of the concerns which was raised by young people from Ukraine was that they sometimes felt that they weren't included in discussions of health. So I'm just really curious whether they were also considered.
Yep. So answering to the first question, no, we didn't face yet pushback, but in a lot of countries we are facing kind of they just ignore everything that happened. So they just ignore requests, they just ignore our emails, and so that's kind of that's a way also to deal with this balance of shifting the balance of power. Just ignore. And about the second question, definitely. First of all, we are focusing mostly in this project on professionals and building professional capacities. But during our we had a study part in which we did focus groups and we did interviews with people all over the Europe about mental health services, about their perception of mental health, their perception of how professionals are working and gaps, etc. So that was one of the ways for inclusion of youth activists. But on the professional level, we are allowed to accept, and we accept peer-to-peer workers and youth workers as well as part of this social kind of social work area, which is a part of our term preference. So we are doing it.
Thank you, Vitalli. I'll finish with just one mental question that I have to you, and I'm sure you have maybe a few minutes after this session if anybody wishes to ask a question in person. So my question is, how do you stay hopeful and motivated? Working personally, extremely challenging, geopolitically devastating times, and what gives you the greatest sense of purpose professionally now?
So I deleted Facebook from my phone. And I deleted a lot of news channels from my phone. It helps. It helps a lot. But another part definitely is my family. And another part is just, this I don't know, maybe it is not correct in terms of kind of the psychotherapeutic kind of things and in terms of psychological and mental health, my own. But sometimes I just get feelings that I just have to go on. I just have to continue to doing things and I just cannot stop. It's just not, it's not time to make a stop. It's not time to make a pause. And maybe I will do it later, maybe at some point. maybe it's correct, maybe it's not, but it helps me. It helps me to move forward. It helps me to kind of plan, to engage, and definitely, I have my ups and downs, and usually that's sometimes on weekends. I'll now try not to work on weekends. It helps from on one side. On the other side, sometimes I just feel like, okay, what to do? Yeah, so in those times, I just feel a bit down, a bit, not depressed. I wouldn't say depressed, but in a mood. I would say in a mood. But then I have my chores, my obligations to make a breakfast, and again to keep going. No, just keep going. It's just my way.
Thank you so much, Vitalli. We're really grateful for your time and sharing your personal and professional journey with us. Thank you again.
Thank you. Thank you for coming.